So, paranasal sinuses, nasal septum, and hard palate. Paranasal sinuses are these cavities inside the skull. They warm and humidify the air. And also, it just puts some holes in the middle of your head so that the skull's not quite so heavy. The nasal septum separates the two passageways, and so you have good airflow. And then you have the hard palate forming the base of the skull and the roof of the mouth. So it's the maxilla and the palatine bones. That's the hard palate you can feel with your tongue. There, and this forms the base of the skull, or the roof of your mouth. So, next slide. So, here's the position of the paranasal sinuses. So we have the frontal sinus here, and we have the ethmoid sinus here. We have a sphenoid sinus number 3, and we have the maxillary sinus number 4. So you can see those guys. Next slide. Here's your nasal septum. So you have a frontal sinus showing there. You have a sphenoid sinus there. Sella turcica is here. You have the perpendicular plate of the ethmoid bone there. You have in the front of it, this is cartilage here. So this is hyaline cartilage. Oops, cartilage. We have the nasal bone there, and then we have the vomer bone, which sticks down, makes the bottom part of the nasal septum. Next slide. So here's the picture out of your guys' book showing the frontal sinuses, the sphenoid sinus, the nasal cavity, and the maxillary sinuses there, as well as ethmoid sinuses, or ethmoid air cells, they refer to them. Next slide. So we're talking about what happens when you have a deviated septum. I was coaching baseball, and kids were throwing the ball out in the outfield, and ran out the outfield, was running, and thought I'd be cool and pick it up on the run, and outfield was wet, and I slipped and fell and landed right on my nose. So I have a deviated septum now, and this is what it looks like. So a lot of people have this. It can cause some breathing issues, but most people it's pretty much okay. It doesn't cause too much problems. We'll go on the next slide. Here's what a deviated septum actually looks like in a person. So when you look up their nose, if someone ever shows you this, you'll know exactly what it is. It's deviated septum. Next slide. There's also a perforated septum, which is a hole that's in the cartilage separating the two sides of the nose. And sometimes you can get this if you overuse like corticosteroids. So you use nasal sprays, and so a lot of times they'll tell you to spray the nasal spray towards the outside, towards the lateral sides of the nose rather than the medial septum, because overuse of steroid nasal sprays can result in a perforated septum. The cartilage stops growing and then starts actually being reduced, and it inhibits the production of extracellular matrix, and you stop having cartilage there, so you stop having the chondrocytes are inhibited by the steroids, and start getting these holes. So anyway, so that's what a perforated septum looks like. So it can also be congenital, it can be from birth, or it can be gotten from things like nasal sprays. Next slide. So cleft palate, since we're here, one of the things that happens with it, you get folic acid supplementation that usually helps take care of it a lot of times. But you get cleft palate with sometimes genetics, sometimes viruses, sometimes nutritional deficiencies of various sorts. So here's your normal palate on the left. In the middle is the unilateral cleft palate, and on the right is a bilateral, so it's on both sides, cleft lip and palate. So the cleftness is where those bones in the maxilla and the palatine bones did not fuse as well, and also then the skin also didn't come together there as well. So sometimes that can be due to lack of folic acid in the diet. So, and next slides will be some pictures actually of some babies with cleft palate. So just to let you know. Next slide. So here's some babies on the left side. We see the cleft palate, and it looks like it's unilateral on both of these. And then on the right side, you can see they had surgery and it fixed it, and they're all happy little guys. So So the surgery is really good, and it can really be pretty impressive how well the surgery can work. It's kind of amazing. Okay, next slide. Last bit we're going to do what's in the book is the fetal skull, and so here we go. So here's the lateral view of the fetal skull. Same bones are there: frontal bone, parietal bone, the squamous suture, temporal bone, occipital bone, all that stuff. But what you have what are called fontanelles. Here's the anterior fontanelle. You have the sphenoid or anterolateral fontanelle. Then you have the posterolateral fontanelle or the mastoid fontanelle, and then you have the posterior fontanelle. So there's 4 of those that are on fetal skull, and these. So you notice that the bones aren't fused yet. There's still fibrous tissue between those, and that makes the bones of the skull compressible, so it can reduce the size of the head as it passes through the birth canal. And if you've ever held a baby, you may have felt the soft spot on top of their heads, and that's right there, and that's the anterior fontanelle, is what the soft spot on top of the baby's heads is. They'll have that for several months, maybe a year or slightly longer, a little bit longer than that. They'll have a soft spot there until that ossifies and makes bone. So next slide. Here you can see where the anterior fontanelle is, a little more easier, as well as the posterior fontanelle. And so when this ossification occurs, when it turns to bone, it doesn't always evenly produce bone all the way across there and make a suture. And you also notice that one of the things to point out, notice there is a frontal suture here. Okay, the 2 frontal bones on the left and right are not yet fused in the middle. Okay, they fuse, and then that fusion, there is no suture that you can see in the frontal bone. That suture, those frontal bones fuse completely across. The next slide. So here's the fetal skull showing the frontal suture and the anterior fontanelle. Next slide. I'm not going to go over this again, so next slide. This is out of your guys' book, I think. Next slide. And showing the anterior fontanelle again. Next slide. Next slide. Okay, so sometimes, though, the frontal bones don't completely fuse, and this is called persistent metopic frontal suture, or metapism. And you can see that there is a suture there going right down between the frontal bones. So the importance of this is in radiology, you might have somebody come in who has it looks like a skull fracture when you've x-rayed him, but sometimes you may look back at old x-rays of the person. Maybe they had an old x-ray, and you might see that was there then too. If they came in, they had some sort of accident, and you think, oh, it might be a skull fracture, but you always got to think in the back of your head, it might also be just a persistent frontal suture, a metopic suture. Next slide. Here's another case of a persistent metopic suture, which you can see there in this slide. Next slide. Let's see, that was the hyoid bone again. Next slide. So sometimes it doesn't fuse, these bones don't fuse all the way when they're making the sutures, and you get ossification in the middle of the suture. And those ossifications, those little bones that form in the middle of the suture, are called sutural bones. They're also called Wormian bones. And they're just irregularly shaped bones or clusters within sutures. Most often they're in the backside and the lambdoid suture. So here's some pictures of those. Next slide. So here's a Wormian bone or sutural bones. So here's on the left side, left photograph. Here's a Wormian or sutural bone there. Here's another one here. There's another one here, and there's another one there. Now on this side, you see very clearly that sutural bone there, and that one there, and that one there. So just so you know that these are there. So we always present things as like this is how it always is, but there's always differences that are out there. So next slide. And here's the Another example of a sutural bone. It's very clear. You have a sutural Wormian bone right in the lambdoid suture right there. So that's it for the skull. For the PowerPoint, I'll do a short video showing you some of the features of the skull, and I'll hold one up and show you some things like that. So then we'll go into the vertebral column next, and so that'll be the next set of PowerPoints. And I'll see you guys in that one. Bye.